All right, I think we'll go ahead and get started here. If hopefully everybody can hear me. If you can't, if you could just either use the chat or question area and let me know if you're unable to hear, and we'll get those issues resolved. But without further ado, I'm going to turn this over to Holly Ahrens. Holly is our clinical IT operations manager. And today we're going to be talking on a topic that eventually everybody will get to, which is the registration and attestation to begin really the incentive process with meaningful use. So I'm going to go ahead and turn this over to Holly, and hopefully you can sit back, enjoy some lunch, and listen to Holly's presentation.
Okay, thanks, Jeff.
Mute myself here.
All right. I'm just waiting for my screen to come up here. There we go. And I'm hoping everyone can see my screen in just a moment. It should come up. I apologize, we've got some delay here. And there. All right. We're good to go. Well, thanks everybody for joining us today for Registration and Attestation 1, 2, 3. Today we're going to review the CMS processes that are required to obtain incentive monies, whether you're an eligible professional or eligible hospital CAW. Now, it may not be as easy as 1, 2, 3, but I'm going to try and break it down as much as possible and in the review of the guidelines, and then also give you some tips along the way through the phases. And the phases really are registration, prior to attestation, during attestation, then after attestation. Those are really the main things that I'll be focusing on. And just an FYI that if you are an eligible hospital or CAW, that you have 20 days until your first year of our participation. That 90-day reporting period would start. So you've got July 3rd is that start date. So just an FYI, if you're tracking that, that's when your reporting period will start. All right, we're going to be looking at two processes actually, and they're very separate, but they are related. The registration process and also the attestation process. They are two processes for both eligible professionals and for eligible hospitals. Now, prior to registration, the first thing that you have to identify is who will register and attest. Now, there are restrictions on who can register and attest for professionals and hospitals. The eligible professional themselves can register and attest, or you can assign an authorized individual to register and attest for the professional or the hospital. Now, I want to make sure that you understand that it's not allowed for a person within the organization to use the provider's user IDs and passwords to enter that information for them. The process, if you're going to assign or if you're going to be working on behalf of a EP or EH, you have to obtain identity and access security clearance through CMS. And we're going to go through that so you understand that process. And that's what HealthPoint actually has done for several providers as a service to them. So you wouldn't have to learn these particular processes, and we would do that, kind of that labor for you. Now, there is some differences with Medicare and Medicaid. When you are obtaining security clearance with Medicaid, they are requiring in South Dakota that you obtain an additional signed form by that provider that you have been authorized to act on their behalf. And again, I'll go through that in detail. On these first few slides, you're going to see this little star down here. It's just my recommendation. Be prepared. It's the best way to cut this time of registration and attestation down. I know when I started, I wasn't so prepared, and it was a probably a 1 to 2 hour process depending on how ill prepared I was. So you can cut it down to 15 to 20 minutes for registration, or if you're really good, getting down to 5 minutes, but it's all about being prepared. Prior to registration, you want to ensure that you have the following: the NPI, the National Provider Identifier, and you'll need their NPPES user ID and password. And that providers, if they're assigning you to act on their behalf, you will have to have your own user ID and password. The payee tax identification number, if the provider is reassigning their benefit, their incentive payment, and that payee's national provider identifier, the NPI number. Also, if you're a hospital, you'll need your CCN, your CMS certification number as well. Prior to registration, this is what we're going to kind of do today, is review these guidelines that CMS has put out for EPs and EHs. I've provided the links here, and Jeff will be putting this presentation out on our website so you can access these links. But reading these ahead of time, I know you're probably not going to turn around today and register and test, but to have these on hand when you need to go through the process is a great way to make sure that you're prepared. So let's look at this first Medicare EP registration guide. And I'm hoping all my links work. I have them up if they don't. I might just switch program here.
Full screen.
I'm going to go to these. I have them up already, which I thought this might happen. Okay, here we go. And Jeff, can they see that then? Okay, great. All right, so this is the guide that you will see on those links. And we're going to just go ahead and start right here on page 3. You'll notice that the site has a lot of wording in it. I want to make sure that we kind of show you everything that's on here. They're really giving you a list of the overview of eligible professionals, both Medicare and Medicaid. And you can see that here. This is the Medicare and Medicaid. There's quite a few links to the CMS website. I do want to tell you that when you click on any of these links for the CMS website, it does not take you to the topic that you are looking at. Let's say, for instance, this Medicare Advantage organization. If I clicked on that, it would not take me to that particular topic. It will just take me to the general CMS site, and then you have to then find what you were looking for. So that's just an FYI. All right, so this is the first page of the site. You have to click Continue to move forward in this site. When you get to the next page, it really is a warning. They are saying that only authorized users are allowed to use this site, and you have to check this box right here. It is required for the continued button to light up. And I'm going to give you here's the actual site. So you have to click Continue. And again, clicking that box so you can get the Continue button to light up. The login instructions then that they have, again, they have the eligible professionals. It identifies who is able to log in. So the EP using your NPPES. If you don't have one, they have a link to the NPPES. And then if you're a user working on behalf, you need to create a login for the INA system. Same thing with hospitals and people who are associated with both EPs and hospitals. Again, you have to create a login. So you have to enter in that NPPES login information, and providers most likely have these as they registered for an NPI. They had to create an account. So in somewhere they would probably have this information. I'll show you how it looks when you log in. And I can't go fully through mine because I do have provider information in here. So you'll see when you enter the site that it gives you tabs here at the top. You have your home page, your registration page, your attestation page, and status page. On the home page, basically it's giving you a review of the registrations, the different tabs that are up at the top. So these are the actions that you can do while you're in registration, attestation, and then status. You can view the current status of each provider that you are either acting on behalf or the provider yourself. So in registration, that tab again shows you what actions you can do. Attestation, again, actions, and then status. You would be able to select a person there. So let's go back to the home page, and I will return to the guide. Let's talk about acting on behalf of a professional or a hospital. You'll see here that the bottom they have the identity and access management system. You will have to click on the yes to continue, so you will be navigated to that system. And at that point you will be asked, and these are probably the most silliest questions you would ever be asked, but some of them say what is 1 + 1 or how many tires are on a car. These security questions, and I use that term loosely, this is really just to identify that you are not a computer trying to access this system. So when you move into the next screen, it's going to actually ask you to start creating your user ID and password. And again here the user ID, your password, and then it requires that you enter 5 different security questions and answers. Okay, so that's required. The next step then would be to create a profile. All of the notifications that will be sent to all the email that you provide on this page. You have to provide your first and last name, your date of birth, your social security number, not a provider's or hospital TIN or anything. This is yours, personal, your email address that you want to use. And then the next screen over here is your employer's information. So this would be the person that you work for, their employee identification number, their legal name, and business address, work phone. Okay, because you're actually, if you're working on behalf of the EP or hospital, that they are actually asking to verify that you are who you say you are. The passwords and user IDs are case sensitive, so make sure you remember that. Now once you get into the system, it lets you add multiple providers or hospitals that you're going to act on the behalf of, and you can put in up to 1,000 different providers. So you'll click on the button Add Access Request and then click Submit. The next screen then will ask you what request type are you going to be asking for. And for eligible professionals, you will be requesting that you act on behalf. But for hospitals, you will use the one right above that you want to be an end user for a provider or supplier organization. And then you would click Next. Then the application type. There is probably only going to be one that you could access, and that would be the EHR incentive program. And again, click Next. At this point, you will start entering the provider NPIs that you're being asked to work on the behalf of. So you enter their NPI here and click Search. It will bring up what they have under that NPI. Verify that this information is correct. And you can either save if you're only looking at one, or you can save and add another. Okay. Then once you get requests in, you will be asked to select which ones you want to submit, you click on the little box that is next to their name, their tracking ID and number, and you click Submit. You'll get this screen. At this time, you will just get just a verification statement that you have submitted a request. Any communications now that you will be getting will come from the external user services, and it always comes up as EUS, customer service, on your email. So ensure that that is being allowed and does not go into your junk email. Now once you have received back, and at that point the provider then will get an email and says that someone is trying to act on their behalf within the system, and they will then be able to open up their account and authorize you as a person to act on their behalf, or the person who is the authorized official within the hospital will get that email, and they will be able to authorize you as the end user for that organization. The process gets hung up at the provider or the hospital level. So what I've done, as soon as I submit that, I send that verification email as a forward to the provider that I have that I'm going to be requesting to work for, and just notify them that they should be expecting an email, and that to please make sure that they address that immediately, because their incentive dollars, you know, there's a time-sensitive type of urgency to that for their incentive dollars. So once you receive that authorization back from that provider, EUS will send you that you've been accepted. You can then go back to the same login screen that we started at, and you'll be able to log in to register. Okay, so if you are the authorized individual already at the hospital, obviously you won't be going through that INA. So you go ahead and log in, and what you're going to do is click on the tab registration or on the button on that screen. So once you click registration, all of the providers that you have been authorized, or the provider themselves, that NPI, all their information will be there on this screen, and these are the existing registrations that you can act on. This one they show is a new, it has not been started, so you would click register, and it will open this new screen, and it will show you these three different categories: the EHR incentive program, personal information, and your business address and phone. These have to be completed before you can complete a registration and submit. All right, you can hit proceed with submission. The next screen is very important. Now for hospitals, you can register for both a Medicare and Medicaid registration, but for professionals you must choose a Medicare or Medicaid incentive program. So down here you would select which program you are going to be participating in for your incentive, and then you would select your eligible professional type from the drop-down list. It is not required at this point, but you have to answer the question about certified EHR, which is, do you have a certified EHR, either yes or no, but the optional part is if you have that certification number. Now that number comes from the Office of the National Coordinators. It's called the CHAPL list. It's the certified EHR list. You can go out onto that website, and they provide a link within the registration screens to go out and find out what that certification number is. But again, not required here, but if you do enter it here, it will default into your attestation. So then just make sure that you save and continue. The next one is your personal information. This lists what they have on file under that NPI for that provider's name. So very important to verify that this information is correct. And the required things here now are you're going to identify who will be the payee. Now the options are that the provider can be the payee, or they can have that incentive dollar sent to a group or organization. So you would either select whether it's the billing or the Social Security number, and that following entry will receive that billing number that they have. Then they will have that name attached to it. Okay, and then save and continue. All right, and then your business phone and address. Again, this information is what they have on file with the NPPS attached to the NPI. Make sure this is accurate. You can edit at this point. This will only be saved at the registration level. This will not be saved at NPPS and will not change what is with your NPI number. Okay, and email address, all of that, and save and continue. Now at this point you should have completed all three of those topics and you could proceed with your admission. Okay, they're going to give you a verification, and this time again, very important to verify that the information is accurate. They have given you a registration ID. This is a very important number right here, the CMS Registration ID. This number will be used if you're going to register and attest with Medicaid. So make sure that at this point you know that what this number is. If you've verified that this is correct, you can submit registration or hit exit and you would go back to the home screen and you could edit further. There is a disclaimer. You must accept and agree to this disclaimer. I want to make sure everyone sees this part here, this user working on behalf of provider, that you read that you're registering on behalf of provider and that they have given you authority. You and the provider could be held responsible for all this information that is entered, both at the registration and at the attestation level. Again, if you're misrepresenting or fraud, that they will have the ability to provide penalties or sanctions. So if you agree, you will move forward. Obviously disagree, you would return. All right, so if you have a successful submission, you will get this screen that you've successfully registered for the EHR incentive program, and an email is going to be sent to that address that you have on file. Again, this is your tracking number, the provider name, the submitted date, and the submission that you're submitted for the incentive program. Very important that you print this receipt, and whether you're going to print it, scan it, and create an electronic file, but you must start your CMS audit file at this point. There is a guarantee that there will be selected providers that will be audited, and also people who act on behalf of providers will also be audited. So we're going to talk about that audit file in a little bit, but this is very important that you print this information. And I don't really like to keep paper folders, but what I've done is print them, scan them in, and then make them a file attachment in my CMS audit files for providers. Now, if you get a rejection, a rejected attestation, they will give you reasons why, okay? Just read those instructions on the sheet, and it will give you information of who to contact if you need. So this one, this isn't very clear, so I won't get to. Here's the reasons for rejected. If you are listed as on the death master file as a provider, you will be rejected. Now the reasons for, you may have a pending status, that maybe your NPI has been deactivated for some reason. Your enrollment status in PACOS has not been approved at this time. If there's any OIG exclusions on your NPI, that would be a reason why. Or if you're a hospital-based professional. What they do is they take that NPI that you've entered and they have a calculation in kind of in the background to identify off of your claims on that NPI whether you are a hospital-based, which means that 90% of your allowed charges or your services were in an inpatient setting. If that happens, then you would not be eligible for the EHR incentive program. Just an FYI here, I have had providers that have been determined to be hospital-based, but they refute that they have 90% of their services within the inpatient unit. We've had to go through the process to call the EHR incentive help desk, and what they've done is they sent us to the appeals line, and what they do then is they send us to it's kind of a clearinghouse that does these claims, and we had to get verification from them that the number of actual services that they had identified as being hospital-based, and that information would go back to the EHR help desk. So it is a long process. It takes some patience, but if you need help with that, just let us know and we can kind of walk you through it. So if you have gotten a rejected or a successful submission, you can always check your status. And how that looks is once you click on that tab, it shows that provider, and you can have a list of providers that you are working with. You just select that person, and then it would show you a status of where they are. And that's what this looks like. So it shows you the incentive program that was chosen, the registration status, and the reason. Okay. Now, if you have selected Medicaid as your incentive program, and you've submitted your registration, because you have to start at this site even though you're registering for Medicaid, this would say Medicaid, and it would probably say active, and then it would say Medicaid, and it probably, if you just submitted it, it would say submitted to state for approval. Okay? There is a time delay from the time you submit your CMS registration and when the state program will have you into the system. It's usually about 24 hours. That's the time that I give them. I check them in 2 days to see if they've been entered. And I will show you quickly the Medicaid program. This is what their website looks like. And to create an account, first time that you are entering a provider or registering a provider with Medicaid, you would create an account. Okay, come on. All right. You would enter the NPI, the provider's NPI, and like I said, that registration ID number that was on your submission, that screen that I said to print, that's what you would enter here and then hit submit. If they have you in the system, then it would go ahead and let you begin creating a username and password. If not, it will say that you don't have an active certification or NPI number, and you would just have to probably wait a few more hours or another day. All right. Okay. Well, we've gotten through registration. And it is quite a long process, like I said, if you're not prepared. So if you're doing several of these, it definitely is putting together a check sheet or a worksheet type of thing to make sure that you've got everything for everyone that you're going to be entering. Now, here's the link for the South Dakota Medicaid. So if you want to get to them, you can click on this link after our presentation. All right, I've gone through the changes that you needed for the hospital, so we won't go through that entire guide. It is the same thing, but you need to have those things that I identified, the CCN. You need to know whether you're going to do both Medicare and Medicaid or if just one. Okay. Now, as we move into attestation, this is where a lot of the documentation needs are a lot greater than registration. And again here, be prepared for all of the information that you need. You need all of your meaningful use reports. And my suggestion to you is to make sure that you're doing one provider at a time and keep their reports very separate if you can. If you have reports that you are finding that are not accurate and they're from the vendor, so let's say the vendor has a canned report for meaningful use for every measure for each provider, and you're seeing some inaccuracies, we are able to report these vendors to the ONC via the Regional Extension Center. So we have a process that we're able to use to document what exactly is the issue, what are the differences between what the report is showing and how it's contrary to the standards and certification criteria that this product was supposed to go through. And then we would document how the vendor has tried to fix this problem, and then it would be submitted for review. So if you are having those problems, give us a call. And then also make sure that all of this data on these meaningful use reports is from certified technology. All right, so during attestation, there are several guides. There will be your EP attestation guide and your eligible hospital attestation guide. And you'll also want to have with you the measure details, the meaningful use measure detail guides. Now, I've always tried to keep those open whenever I'm doing attestations, so because it gives you the full definition and FAQs that you can go to if you need. So I'm going to pull up those as well. That's not it. Well, I guess I can use my link here. There we go. All right. So this is the Medicare user attestation guide for eligible professionals. Again, for the purposes of time here today, I'm going to go through this one and I will show the differences between hospitals and the eligible professionals. All right, you're going to log into the same screen that you did before for registration. Again, you have to hit continue. Again, you always have to check that box that you've been warned, and then you continue. Log in. And then you get to your screen with the tabs, and you would click on attestation. Again, it shows you that you can attest, modify, cancel, resubmit, reactivate, view, and not available. These are the actions you can do on this screen. So you'll see once you have registered, then your provider comes up on this screen, and the action that you can do at this point, because you haven't done anything with this new provider, is attest. If you'd already started an attestation and had to exit for some reason, you could modify, cancel, or resubmit. All right. It shows you the reason for attestation, that you're a Medicare EP and you're modifying this attestation or submitting a new one here. These are all the topics that must be completed to submit. All right. At this point, you will be required to have your EHR certification number. Again, you can get that at the ONC Chapel website. And like I said, if you did not have that entered at registration, it wouldn't default, but if you had, it would default at this time. Okay, so then the next is your reporting period. Now, your reporting period needs to be at least a 90-day period, so you would enter that in here and click Save and Continue. There's a screenshot of the ONC Chapel list there. All right, for the core measures, they're going to list these out, and they've done this pretty well. It is helpful for, oh, I'm sorry, I do want to show you one thing in regards to this screen for hospitals. Again, you would have your certification number for the hospital's EHR, But the thing that you would see that is different for hospitals is your emergency department admissions. The eligible hospital must choose one of two methods to designate how patients are admitted to your ED or your emergency department that will be included in the denominators of certain meaningful use core and menu measures. So you have to select either the observation service method or that all ED visits method. Now I want to kind of give you some information about that because that, I'm assuming most people have read through this, but I want to just read through it real quick for you. The observation method, if you're using that for denominator, this is where the patient is admitted to the inpatient setting through the ED. The orders entered in ED are using certified technology which count for purposes of determining the CPOE meaningful use measure. Okay, so if this patient initially presented to the ED, treated in the ED observation unit or used observation services, okay, you could use them in the denominator. If you're using the all ED visits, this is an alternate method for computing admissions to the ED. You're including all ED visits at POS 23 in the denominator. Okay. If you want more information on that, I can just give me a call or send me an email and I'll give you the full description. All right, when we get into the core measures, there are 15 of them, so I'm only going to go through a few just to show you the differences and how they're laid out. Again, red asterisks are required fields. It is always helpful that it shows which provider you're working within at this point. So you can then match that to the report, the meaningful use report you have in front of you. So they have the objective written out and the measures. So CPOE for medication orders directly entered by a licensed healthcare professional who can enter orders into the medical record. The measure is more than 30% of all unique patients with at least one medication in their medication list that was seen by the EP having one medication entered using CPOE. Read all the exclusions, okay? The exclusion here is that based on all records, an EP who writes fewer than 100 prescriptions during that reporting period. You must answer this. Does this exclusion apply to this provider? Either yes or no. Okay. The next, you must answer this question. Please select whether the data was extracted from all or only patient records that are maintained in the EHR, and you make that determination. This changes on measures, so you have to look at every single one of these measures, and if there is a change in this, these denominators, then you would be asked to select this. It describes what the numerator should be and the denominator, and then you must enter off of your meaningful use reports what those numerators and denominators are. If you wanted to return to home or go to the previous screen, obviously, but save and continue at that point. Now this measure, it will take you to the next one. This one is the drug-to-drug and drug allergy interaction check. This is at just asking if functionality has been enabled, and this is just a yes or no question. If you're having trouble with these measures, there is this meaningful use measure specification page. This is a clear description about the measures. It's what I had talked about, that detail page. It goes directly to that page if you don't have a printed version next to you. Again, save and continue, and I'll show you one more here. Up-to-date problem list. Numerators and denominators are only needed, so you didn't have to identify if this was all patients or only patients that were in the certified EHR. All right, we're going to go down to Page 29, this is where we get into the menu measures. For EPs, you're going to have to select 5 measures, and what you do is you select them on these little boxes. You select which ones you are going to use, and then it will bring up only those 5 in the next screens. Remember that at least one of your measures has to be from the public health list. All right, so I'll show you some examples here. This is one that was selected, the capability to submit electronic data to the immunization registry. This is a public health measure. Read the exclusions. Again, you must answer either yes or no on all of the exclusions. Again, the requirement is to answer all of the red asterisks. And then save and continue. And then, oops. So again, it goes through, the guide has all 10, but like I said, they will only bring up the 5 that you had selected. All right, we'll move to clinical quality measures. And everyone needs to answer this question in regards to e-reporting. And this is about PQRS, and it asks the question of whether you are you planning to participate in the PQRS system Medicare EHR incentive pilot for 2012. This information you'll have to find out from your provider or your hospital, but if you do select yes, you will not be able to submit your clinical quality measures through this process, this attestation process. You'll have to submit them electronically, and until you have that submitted, you won't be able to, you can finish up your attestation here, but the process for the e-reporting will have to be done separately. If you select no, then you'll continue into the attestation process within this CMS. All right, so you're going to have to select, as we all know, you have to select a total of 6, so you have to have 3 cores or the alternate cores, and then 3 of the additionals. So you will go in here, and they will list all of the core measures, and you enter in your numerators and denominators. Again, reading through, making sure that you have the correct populations. Save and continue. Several of the clinical quality measures have multiple aspects to them. There's an A and a B for tobacco assessment. You have to see how many have been done for that, and then also for the interventions of the cessation programs that have been implemented. You would have to enter that as well. Again, they have a link here for the measures specifications page where you can click on that and it will take you to the detail of that. Now I want to show you one that has exclusions here. This particular one is the adult weight screening and follow-up. So you would be putting in different populations, and that specification page will show you what these populations are. So the percentage of patients age 18 and older with a calculated BMI in the past 6 months or during the current visit documented in the medical record, and if the most recent BMI is outside parameters, a follow-up plan is documented. So you would run those reports for your CQMs and then list your denominators and numerators, and if any exclusions, you would have to enter those as well. If the exclusion is 0, then enter 0. Okay, but you have to enter something in there for you to be able to save and continue. Okay. Now the next is the alternate core. Now obviously if you have not selected any of the initial core, then you would have to select all 3 of these alternate core. If you selected 2 of the CQMs, you must select. If you entered 0 on 2, you'd select 2 of the alternates. You kind of understand that, I am sure. So again, you would enter your numerators and denominators for your alternate cores. If you have this, if you need to know what the population criteria are, again, click the clinical quality measure specification pages. All right, I'm going to go down to page 47. This is where the additional clinical quality measures are. You have to select 3, and again, you will do the selection box. Once you select those, it will then bring up those 3 that you have selected. Okay. All right, at that point, you should be showing all of those elements that are complete, and you would be able to continue with your attestation. If you have any things that you need to edit, you're given the opportunity to do that now. It's very important that you understand that you review all of your attestation information before you submit. Any EPs who fail their attestation, you can't submit that information again. You have to submit information for a different time period. So if you, let's say you did from 1/1 to 3/31, you wouldn't be able to submit again for that same time period. You would have to go maybe a day later and do 1/2 to 4/1. So make sure that you check and recheck these numerators and denominators and all of these measures again, just to ensure that you are not going to get a failed submission. Review, review, review. Again, be prepared. If you do need to edit one, go ahead and click on the edit button. It takes you back to that screen. Now, if you have gotten through all your edits, you click, I'm going to go back here, continue with your attestation. You again have to, you get some warnings here and you are making some statements. You have to click each one of these boxes to agree to those attestation statements. And you can agree or disagree down here at the bottom. Okay. If you disagree, you go back to the home page. If you agree, you move into the next screen, which is your confirmation. So then again is your provider, Social Security, MPI, EHR certification number and the reporting period that you are attesting to, and then you submit your attestation. Again, the disclaimer here for attestation is also for users working on the behalf, agree or disagree. Once you submit, if it's accepted, then you will get this statement. Okay. Your tracking number. This is your attestation confirmation number. This is very important as well. This is what you'll use for tracking. You can print at this point, again, for your audit file. You can also review results to view the summary of detail of all of your measures. Okay, and it will show you the calculations at that time of what your percentages were and if those were accepted. If you get a rejection, it looks the same as the registration did, and again, you will, there are reasons why there's probably an error in your calculations or you didn't meet the required thresholds for the measure. You'll go to review results and then you can review that, and if you need to edit it at that time to resubmit, again, you would have to resubmit for a different reporting period. Okay. Okay. That's just showing how you go through that resubmission. And then the confirmation page again and disclaimers. Okay. We'll go back to Now after attestation, again, what if you've already submitted, let's say you entered the wrong provider name. If you need to correct any information, you have to call the help desk. These things get locked for review and payment, and so you'll have to call the EHR Information Help Desk at 1-888-734-6433. They are on Central Time, which is kind of good for us, so we kind of know that they're on the same time as us, from 7:30 a.m. to 6:30 p.m. Now, a lot of people have questions about how you're going to get paid. The payments to Medicare providers are made to that tax ID number that you selected when you registered. So whether you assigned a payee or you used your Social Security number if you're the provider, that's who it would go to. Attached to that, it will be deposited in the first bank account that they have on file attached to that tax ID number. And you'll see that on your bank statements, it's EHR incentive payment is what it is, the subject there. Oops. And if you receive your payments for Medicare via electronic funds, you'll receive that the same way. And there's no notice that you will be getting that payment. So I've had people who've received their payment didn't know about it until they did their monthly reports, and there it was. Now, the audit file that I had talked about, in the HITECH Act and in CMS's information, all they say is that retain all relevant information. Well, I think both you and I know from history with CMS, retaining all relevant information, you have to retain everything. And it may not feel like it's relevant, but make sure that you're keeping everything that you've used to make this determination. You have to create these specific to those providers. This is how I've done them, is made just a provider with that provider's name on it, with the attestation year, and listed all of this information. Have to maintain that for 6 years from the date of attestation. This is my recommendation at a minimum. Like I said, they did not outline what was needed specifically, but this is what I have put in mine, is the registration submission confirmations, your INA authorization, that email that you get back from the EUS stating that you've been authorized, your meaningful use reports that were used for attestation. Some EHRs do not archive these reports, so make sure that you're either printing them or you're saving them in electronic format and attaching them to these provider audit files. Your EHR purchase agreement, if you're attesting to Medicaid for adopt, implement, or upgrade, you need to have some sort of purchase agreement, a receipt, license agreement, something in that vein. You'll need a patient volume report, the report that shows how you calculated your patient volume to determine your Medicaid volume. And I would make sure that this is not something that was taken from a report and created in Excel or something. I would save the report that came directly from your practice management system or whatever system you use to calculate numbers of claims or your billing system. Your attestation confirmation, that print screen that was in the CMS attestation, and then your payment confirmation. Your billing system may archive this, but again, it's something that I think it would be a good idea to either print this off or create an electronic version of it. Now at this time, I'm going to open up for questions, and I'll help you as much as I can. And I think we've already had a couple. I'm going to go back to the webinar screen. Are those questions there? Just got them up on the board for me, which is very nice. The first one I see, how does the doctor find his ID number? And I'm assuming that is that the certification ID number, or is that the NPI number? Yeah, let's go ahead. And I think that was from Teresa. We're going to unmute everyone so
Okay, everybody is unmuted at this point in time. So Teresa, do you want to maybe restate your question for Holly on your doctor's ID? Okay, maybe Teresa can't hear us right now. Then the next question is, how long does it take them to get back with someone once they get through this? I did this last December and haven't heard from anyone. I assume she's talking about the registration process.
Okay, that's from Teresa. Well, these are all from Teresa.
Muted.
How long does it take to get back with someone once they get through this? I did this last December and haven't heard from anyone, so I'm not sure which process she's talking about, but I can tell you that, like I said, with the identity and access management system, getting that security clearance, really the hang-up is with the provider. Now, for registration, again, if you're registering for Medicare, that is pretty quick. They're able to get those registrations and able to be able to get through attestation, I mean, in the same day. If you're registering with CMS and then you want to attest with Medicaid, it does take a day for that to open up. They have to send it to the state, and they have to review that information and then allow that account to be created in the South Dakota side. So I'll follow up with Teresa and get these answered for her specifically. The next question that she had was, South Dakota does not allow optometrists to get the incentives, although they're listed in the guide. And the guide that I had was for Medicare, and they are included. They're not included in the Medicaid incentive program. So, any other questions? Oh.
Teresa, we couldn't hear you. If you said anything, I apologize. Her answer back was, we started the process for the security clearance, but we have not heard from anyone. The doctor cannot remember his ID to allow him to account for it.
Okay. What I suggest then, if the provider does not remember their ID, they need to go in and say they forgot their password, and they will probably have to call the number to get that password, because they usually don't send them to emails, that you have to call and get that reset. And I had to do it as well. I had forgotten mine when I first got on, and it was a few weeks before I got on again, and I just called the number. They were very helpful. I just identified myself through a few questions that they had to ask me, and they gave me my my password. It does not change, so they will give you the password that's on file.
Okay. Does anyone else have any questions? You can either type them into the question box, or just, since we have the microphones unmuted, feel free to just throw your question out right now, Holly. Okay. It doesn't look like we have anything coming in. Holly, is there anything else you want to say?
Yeah, I just wanted to thank everybody for your time. I know these processes
Unmuted.
It's difficult to.
Oh, you're muted.
he's muting me. Sometimes difficult to navigate through them, so I just wanted to offer that we can help with this process. If you would like someone to, sit down and go through the process along with you as you're acting on behalf of a provider, we can do that as well. If you have any questions, feel free to give me a call or email me on a specific thing. And again, we do offer the service of doing this for providers and hospitals. So there are some different alternatives for you if it is becoming arduous. So thanks again, and I hope you have a wonderful day.